All right, so are you ready to explore a fascinating world? Today we are doing a deep dive into the world of experiential therapies.
Ooh, I love a good deep dive.
You've shared an amazing chapter with me from a psychotherapy textbook,
Mm-hmm.
and it's all about how these therapies actually work,
Yes.
especially Gestalt Therapy,
Ah, Gestalt Therapy.
developed by the one and only Fritz Perls.
Of course.
And it also talks about emotion-focused therapy, which seems to be gaining in popularity these days.
Yeah, it's really interesting stuff.
So this chapter really digs into this whole idea that healing can happen when we actually tap into our emotions rather than just talking about them.
Uh-huh.
It even talks about this story of a man named Howard and his wife Ginny,
Oh, I love that story.
where he actually finds relief from erectile dysfunction through Gestalt therapy.
It's a powerful example.
And the twist is that it involves him giving a voice to his penis.
That's right. The case of Howard and Jenny really kind of highlights the core of what these therapies are all about. It wasn't about trying to suppress or ignore Howard's struggles,
Yeah.
Instead, the therapist actually encouraged him to confront his emotions head on,
Right.
even if that meant having a conversation with his own body.
So let's unpack this a bit. What exactly happened with Howard and Ginny?
So they had been trying all the more traditional therapies for erectile dysfunction, but nothing was really working.
Oh, wow.
So then a therapist who was using Gestalt techniques actually asked Howard to try embodying his penis and give it a voice.
Oh my goodness.
It sounds unconventional, but that's kind of the beauty of experiential therapy,
So what did Howard's penis have to say?
Well, speaking as his penis, he said, "You're asking too much of me, Howard. You've been asking me to carry the whole meaning of your life on my back, and that's just too big a load for any one penis to carry. I'm bound to bend under such weight."
Wow. So he was putting so much pressure on himself.
It was a huge moment of insight for him because he realized he was carrying this massive emotional burden,
Right.
which was manifesting physically.
It's pretty amazing how this seemingly odd technique helped Howard connect with his emotions on such a deep level.
Exactly. Experiential therapy recognizes that our emotions aren't just these abstract things in our heads.
Right.
They're deeply connected to our physical experiences and how we actually interact with the world around us.
That's a great point. So this brings us to Fritz Perls, the man behind Gestalt Therapy. The chapter mentions that he had a pretty dynamic personality.
Oh, absolutely. Perls was known for being really bold, sometimes even provocative in his style. He even thought he was the best therapist in the world.
Wow, confident.
He wasn't shy about saying that at all. But beyond his larger-than-life personality, he actually developed this really intriguing approach to therapy.
So what exactly is Gestalt, and how does that relate to therapy?
So Gestalt basically refers to this concept of forming wholes.
Okay.
And in Gestalt therapy, it's really about helping people become whole by integrating their thoughts, feelings, and behaviors.
Uh,
Pearls believe that we kind of build up these layers of defenses to protect ourselves from truly confronting who we are. And these defenses, they can manifest in all sorts of ways. Pretending to be someone we're not, blaming others for our problems, withdrawing from the world. But ultimately, they keep us stuck.
So Gestalt therapy helps us kind of peel back those layers.
Exactly. It helps us shed those masks we wear and finally just embrace our true selves.
That's such a great way to put it. And that process can bring up some intense emotions.
Absolutely.
And that's where catharsis comes in, right?
Yes.
Gestalt therapy sees the release of all that pent-up energy and emotion as a crucial part of healing.
Right. It's like finally letting go of those burdens we've been carrying around for so long.
The chapter also mentions something called consciousness raising as this key process in Gestalt therapy. What does that actually mean?
So consciousness raising is really about becoming more aware of what's happening inside of us right now, like our thoughts and feelings, even our body sensations. Gestalt therapists encourage their clients to really pay attention to those signals, often subtle signals,
Okay.
and understand how they're all connected to their overall experience.
It's like becoming a detective of your own inner world.
Exactly.
Noticing those clues that can lead to a deeper understanding of yourself.
Yeah,
And I imagine this awareness is super important for making lasting changes.
absolutely. It's the foundation. And Gestalt therapy uses some really creative techniques to help people tap into this awareness.
I am so curious about those techniques. Can you give us some examples?
Yeah, so one technique that often comes to mind is the empty chair technique.
Okay.
It involves having this imaginary dialogue
With an empty chair.
with an empty chair, exactly.
Oh, yeah.
Could be with a person you have a conflict with, maybe, or even just with a part of yourself.
Okay.
And it allows you to express those emotions that you might have been holding back.
So it's like creating this safe space where you can finally say those things you've been wanting to say.
Exactly. It can be so cathartic to finally express those feelings and gain a sense of closure. Another technique is called the top dog underdog exercise. So clients actually role play these conflicting parts of their personality.
So it's not about getting rid of those conflicting
Yeah,
parts.
not at all.
It's about understanding them and finding a way to kind of live in harmony with them.
Right, that's the goal. They also use dream work. So they actually act out their dreams to try to bring unconscious material into their awareness. And there's the exaggeration technique where you might intensify your feelings or expressions just to break through any emotional blocks you might have.
Wow, these techniques are so creative.
They really are.
It's amazing how they combine creativity with emotional exploration.
Mhm.
I could totally see how these would be powerful tools for growth.
Absolutely.
And you know what's really interesting is that Gestalt therapy wasn't just about individual healing. Pearl saw it as a way to promote social change as well.
That's right, he did. He believed that by becoming more aware of ourselves, we could also become more aware of our impact on the world around us. So personal responsibility and authentic living, those were essential for creating a more just and compassionate world.
I love that. It's really inspiring to think about how these therapeutic principles can ripple outward and create positive change on a larger scale.
Yeah, it's pretty amazing. And Gestalt therapy really laid the groundwork for this whole realm of experiential approaches.
Right, that's what I'm excited to explore next.
Yeah.
So what other fascinating approaches should we dive into?
Well, there's Eugene Genlin's focusing method, which emphasizes this idea of bodily awareness.
Bodily awareness.
Uh,
What's that?
he called it the felt sense.
Felt sense, okay.
It's really about paying attention to the sensations in your body, not just your thoughts and emotions. So this felt sense, it can be hard to describe. It's this subtle kind of whisper from your body, but it holds really important emotional information.
So it's like tuning into those subtle physical cues. That can provide valuable insights into our emotional state.
Exactly. Genlin believed that by paying attention to those subtle sensations, people could unlock these deeper levels of self-understanding and ultimately even find solutions to their problems.
That's interesting. So both of these therapies that we talked about so far challenge us to be more aware of our bodies,
Right.
not just our minds,
Yeah.
as sources of wisdom and healing.
Right.
And speaking of recent and well-researched experiential therapies, the chapter seems particularly interested in emotion-focused therapy, or EFT for short.
Yeah, CFT.
I'm really eager to learn more about what makes this approach unique.
Well, then let's dive into the world of EFT and the work of Leslie Greenberg. He's a really prominent figure in psychotherapy.
Okay.
He developed EFT by actually integrating principles from both person-centered therapy and Gestalt therapy.
Oh, that's a cool blend.
So one of the key principles of EFT is that emotions aren't the enemy.
Oh, that's really different than how we traditionally view emotions.
Right. They're seen as these valuable sources of information and even a pathway to growth and healing. EFT therapists actually act as emotion coaches.
Emotion coaches, I love that.
They guide their clients to explore and understand and then transform their emotions in a healthy way.
This seems to challenge the traditional view of therapy, where the goal is often to control or even suppress those difficult emotions.
Yeah, a lot of people think therapy is about getting rid of negative emotions. But EFT is more about embracing those emotions.
Right.
And actually learning from them.
I could see how that could be super empowering. Instead of feeling overwhelmed by your emotions or controlled by them, you can learn to use them as a compass to guide you towards a more fulfilling life.
Exactly.
Now, the chapter mentioned that EFT has a really strong research base,
Yes, it does.
which is always a good sign. Can you tell us more about that research?
EFT has been studied a lot and has actually shown some really promising results, especially when it comes to treating things like depression and even couples therapy. It's been recognized as an evidence-based treatment
Oh, wow.
by many organizations.
So that means there's some solid scientific backing for its effectiveness. That's great. So while Gestalt therapy might be more about that creative exploration of emotions, it sounds like EFT offers a more structured and research-backed approach.
Yes, that's a good way to put it. While both therapies really focus on experiencing emotions, they do have different strengths.
Okay,
And they're suited for different types of people and different challenges.
that makes sense. Now, the chapter also mentioned some criticisms of Gestalt therapy, even coming from within the humanistic psychology camp. What are some of those concerns?
Well, some critics, especially from the cognitive behavioral perspective,
Uh,
worry that Gestalt therapy might lead to people not really focusing on social responsibility.
mm.
They think that focusing so much on individual needs might lead to a disregard for social norms and expectations.
So it's about finding that balance
Exactly.
between honoring your own needs while still being a responsible member of society.
Exactly. There are also concerns from the psychoanalytic perspective
Okay.
that Gestalt therapy might not go deep enough into the roots of those psychological issues,
I see.
particularly those that might stem from early childhood experiences. And they argue that by focusing only on the here and now, you might miss those deeper unconscious patterns
Right.
that are contributing to someone's current struggles.
So different approaches have their strengths and limitations,
Yes,
and what might be effective for one person might not be for another.
that's right. It's really important for both therapists and clients to be aware of those different perspectives and to choose an approach that aligns with their values and goals. What's fascinating, though, is that EFT actually addresses some of those criticisms by integrating principles from those different therapeutic approaches.
Okay.
And by emphasizing healthy emotion regulation. It's like this bridge between the spontaneity of Gestalt therapy and the more structured approach of cognitive behavioral therapies.
It sounds like EFT offers a more comprehensive and nuanced approach to emotional healing.
I think so. And I think that's one of the reasons EFT has become so popular in recent years. It seems to resonate with both therapists and clients who are looking for that balanced and effective approach to therapy.
This has been such an insightful exploration of Gestalt therapy and EFT.
I'm glad you think so.
It's so clear that these approaches offer these really powerful tools for accessing and transforming emotions.
Yeah.
And I can already see how those principles could be applied to everyday life.
Yeah, definitely.
I'm excited to explore that more.
Me too. So where do you want to go next?
Well, the chapter dives into another therapy that focuses on the power of relationships, and that's interpersonal therapy.
Oh, IPT?
IPT, yes.
Yeah.
This approach seems a bit more structured and goal-oriented,
Yeah, it is.
especially in how it helps people navigate those tricky interpersonal dynamics
Right.
that can really impact our well-being. So tell me, what makes IPT unique?
Well, IPT really focuses on the here and now,
Okay.
and it examines how these interpersonal difficulties are contributing to and kind of maintaining psychological distress.
Interesting. So it really hones in on those present-day relationship challenges.
Yeah, exactly. IPT works from this idea that our relationships and our social connections, they have this major impact on our mental well-being.
That makes a lot of sense. We are social creatures.
Right.
And when those relationships are strained or we're feeling isolated, it's bound to impact our mental health.
Absolutely. And what's really interesting is that IPT focuses specifically on 4 key problem areas
4 problem areas, okay.
that commonly contribute to psychological distress.
I'm all ears.
Grief,
Okay.
interpersonal disputes,
Okay.
role transitions,
Oh,
and interpersonal deficits.
got it. So 4 different areas.
Yeah.
Let's start with grief. How does IPT actually approach grief?
So IPT recognizes that unresolved grief. It can be from the loss of a loved one or even the end of a relationship or a job. It can trigger or worsen mental health issues. It's like those feelings of loss and sadness get stuck and prevent you from moving forward in your life.
Right. So IPT helps people kind of process that grief in a healthy way.
Exactly.
So they don't get stuck
They don't get stuck.
and it doesn't consume them.
IPT therapists help clients acknowledge their feelings, they help them develop healthy coping mechanisms, and find ways to actually move through the grieving process rather than avoiding it or letting it take over.
What about interpersonal disputes? I'm sure we've all experienced those at some point in our lives.
Oh yeah, interpersonal disputes are so common. They could be conflicts or ongoing tension with partners, family members, friends, even coworkers. Just any relationship conflict that's causing significant stress and impacting your well-being.
And how does IPT help people navigate those often tricky relationship conflicts? Does it involve, like, giving advice on who's right or wrong?
No, not at all. IPT focuses on improving communication patterns and helping people understand their role in the conflict. The therapist might help clients identify those communication patterns that are contributing to the dispute and then work with them to improve their communication skills, set healthy boundaries, and find ways to negotiate and compromise.
So it's really about giving people the tools to have healthier and more productive conversations,
Exactly.
even when there's disagreements.
Yes.
It's like you're learning to speak a whole new language of understanding and empathy.
Right. Often, just improving communication can really reduce conflict and bring back harmony to the relationship.
Okay, that makes a lot of sense. Now, what about role transitions? I imagine those can be pretty challenging too.
Absolutely. Role transitions, those are like those major life changes that can really shake up your sense of self
Okay.
and even disrupt your social connections. Think about like starting a new job, getting married, becoming a parent, even retiring.
Okay.
All of those big life changes. Even positive ones can trigger stress and a lot of uncertainty as you adjust to this new identity and figure out where you fit in.
It's like you're stepping into this whole new chapter of your life.
Yeah, it is.
And there are bound to be some bumps along the way.
Definitely. And that's where IPT comes in. So the therapist supports clients in navigating those changes.
Okay.
They help them develop new skills, build new social connections, and really create that sense of stability and belonging in their new role.
So it's about providing that guidance and support as people are going through these transitions. Help them adapt and find their footing in the midst of all this change.
Exactly.
Okay, and that brings us to that last problem area, interpersonal deficits. What exactly are interpersonal deficits?
So interpersonal deficits, those refer to having difficulties forming and maintaining those healthy relationships.
Okay.
And this could be due to things like shyness or social anxiety, a lack of social skills, or even past experiences that make it hard to trust other people.
So it's not just about navigating those existing relationships, but also about helping people build new ones.
Right.
And feel more comfortable connecting with others.
Exactly. IPT therapists help people identify and address those patterns. The things that are kind of getting in the way of forming those healthy relationships, they work on things like improving social skills,
Okay.
building self-confidence, and addressing any underlying anxieties or fears.
It's like you're giving people the tools to create those more satisfying and meaningful connections, which are so important.
They are for overall well-being.
Now, unlike some therapies that can go on for years, the chapter mentioned that IPT is a time-limited treatment.
It is. It usually lasts for about 12 to 16 sessions.
Okay.
Although it can be adapted for longer-term treatment if needed.
So it's more of a focused intervention with a clear beginning and end.
Right.
Which I imagine helps people see the progress they're making, which can be really motivating.
Yeah, exactly. Therapists actually work together with their clients to set specific goals and really target those key problem areas.
So it's a very goal-oriented and practical approach.
It is.
I'm curious, what does a typical session actually look like? Is it just talking about your relationships?
So IPT does involve talking about your relationships, but it also uses techniques from other therapies.
Okay.
Like cognitive therapy and behavioral therapy.
Okay.
So the therapist might help clients identify and challenge negative thoughts,
Okay.
develop coping strategies, or even practice communication skills.
Okay.
Like through role-playing. They'll start by checking in with you about your mood, any significant events, any interpersonal interactions that might have happened since the last session.
Oh, so it's like you're getting a temperature check on how they're doing.
Exactly, like what's going on in their life.
Right, right.
And then from there, they delve into those specific problem areas, guiding the conversation toward those key areas. So grief, disputes, transitions, or deficits, really focusing on the specific interpersonal challenges.
So the sessions are structured around those specific issues.
Yes.
But they also incorporate these tools and techniques from those different therapeutic approaches.
Right.
To create this really well-rounded approach.
Exactly. The therapist and client work together to understand those relationship patterns and find solutions that will lead to greater well-being.
I love how IPT really emphasizes that collaborative aspect of therapy,
Yeah.
where both a therapist and the client are active participants in the healing process. Now, I know you mentioned that EFT has a lot of research backing it up. Does IPT also have a strong research base?
It does. There have been numerous studies showing that IPT is effective in treating a wide range of mental health conditions, especially depression, anxiety, and relationship issues.
Wow.
It's actually recognized as an evidence-based treatment by a lot of organizations like the American Psychiatric Association.
Oh, wow. So there's some solid evidence to support IPT's effectiveness, which, gives people confidence
Absolutely.
that they're choosing a therapy that's been rigorously tested
It has been.
and proven to work.
Yeah.
What I also love about IPT is that it's adaptable.
It is.
It's been tailored for different populations, like adolescents,
Yes.
couples, and even people with chronic health conditions.
Yeah.
So it's not a rigid one-size-fits-all approach.
It's not.
It's really a framework that can be adjusted to meet different needs.
It can.
That's fantastic. So this flexibility really allows therapists to tailor the treatment to those unique challenges and circumstances of each client.
Yeah, exactly.
And just like in any therapy, that therapeutic relationship is so important.
It is.
Clients need to feel comfortable and trusting of their therapist to be able to openly explore those relationships and be vulnerable.
That's right, they do. And while IPT focuses on the here and now, which can be really effective, it might not be the best approach for everyone.
Okay.
If someone has a lot of deeper unresolved issues from their past, if there are underlying traumas or maybe unresolved conflicts from childhood, those might actually require a different therapeutic approach.
So while IPT can be great for those current relationship dynamics, it might not be the best fit for every person or situation.
Right.
It's important to have that thorough assessment with a qualified professional.
Absolutely.
To determine if IPT is the right fit for your unique needs. Now, the chapter also talks about psychodrama. I am so intrigued by this.
Yeah, it's very interesting.
Do people really act out their problems on a stage?
Sometimes they do, but psychodrama is a lot more than just acting.
Okay.
It was developed by Jacob Moreno, a psychiatrist and social scientist back in the early 20th century.
Yeah.
And it uses those dramatic techniques and role-playing to help people explore their inner world and their relationships with others.
So it's not like traditional talk therapy where you're just sitting on a couch talking about your problems.
No, it's very active. The word psychodrama literally means therapy through action.
So instead of just talking about your problems, you're actually bringing them to life.
Exactly. It might sound intimidating.
A little bit.
But that's part of what makes it so powerful.
Okay.
By bringing those internal conflicts
and those emotional experiences to life, but in a safe and supportive environment.
Right, right.
Clients can gain this deeper understanding of themselves.
Okay.
And find new ways to actually cope and grow.
So I'm picturing a stage with costumes and dramatic lighting. Is that what it's actually like?
Well, it can be theatrical, but it doesn't always have to be these elaborate productions.
Okay.
It's more about the process of actually enacting scenes from a person's life, whether it's past experiences, present challenges, or even future aspirations.
So it can be past, present, or future.
Yeah.
Interesting. So it's more about the essence of drama, using action and interaction to explore those experiences in a tangible way.
Exactly, exactly. And the stage doesn't have to be an actual stage.
Okay.
It can be any space. It could be just a designated area in the therapy room.
Got it. So as long as it's kind of set apart from everyday life.
Exactly. It creates a boundary that allows for a deeper level of immersion and exploration.
So who are the players in psychodrama? Who's on this stage? So you have the protagonist. That's the person whose story is being explored. They choose a scene from their life that they want to work on.
Okay.
And the director is usually the therapist.
Okay.
And they kind of guide the process.
Oh, so like a stage director.
Yeah, like a stage director. They provide structure and guidance, but they also let the protagonist's story unfold organically.
So how much control does the protagonist have over the story?
It's really their story to tell. The director is just there to facilitate the process.
Yeah, okay, that makes sense.
Yeah.
So who else is involved?
Well, you have auxiliary egos.
Auxiliary egos.
Those are other people participating in the psychodrama.
Okay.
And they play roles that are significant to the protagonist's story. Like, it could be family members, friends, or even abstract concepts like fear or anger.
Wow.
So you're really creating this rich and dynamic representation of the protagonist's inner and outer world.
That's so cool. And what about the audience? Are there other people watching?
Yeah, sometimes there is an audience, which could be other clients.
Okay.
If it's in a group therapy setting.
Right.
Or even therapists who are observing the psychodrama.
It sounds like a very interactive and communal experience, even for those who are just observing.
It is. It can be.
So tell me about the techniques used in psychodrama. How does it all actually unfold on the stage?
Well, psychodrama therapists use a variety of techniques to help people explore their inner world and relationships.
Okay.
One technique is role reversal.
Role reversal, okay.
Where the protagonist switches roles with another person in the scene.
Oh, so they get to see things from the other person's perspective.
Exactly. That's one of the really powerful things about psychodrama.
I can see how that would be really powerful for building empathy and understanding.
It is. You can even use role reversal to work through conflicts.
Oh, wow.
Another technique is the double.
The double, okay.
So an auxiliary ego acts as a mirror for the protagonist, reflecting their thoughts, feelings, even those things that are left unsaid.
It's like giving a voice to those hidden emotions.
Exactly. The double helps the protagonist bring those hidden truths to light and really understand their own internal experience more fully.
And then there's soliloquy, right? Where the protagonist actually speaks their thoughts and feelings out loud.
Yeah, just like in a play, they're giving voice to that inner monologue that's constantly running in our heads.
It sounds like such a powerful way to process emotions and understand yourself better.
It is. And psychodrama, it emphasizes self-expression
Okay.
and exploration in a really safe and supportive environment.
Now, with all this talk of acting and role-playing, I'm curious, what does the research say about the effectiveness of psychodrama?
So compared to other therapies, research on psychodrama is a little more limited.
Okay.
It can be hard to study because it's a very complex approach. It involves multiple people and these dynamic interactions. But the research that does exist suggests that it can be effective in treating a range of mental health challenges. There's some evidence, but we definitely need more research to fully understand its potential. But luckily, there's a growing movement within the field of psychodrama to conduct more rigorous research and really try to demonstrate its effectiveness.
That's great. So is psychodrama just used for treating mental illness? Or can it also be used for other purposes?
The psychodrama can be used for all sorts of things.
Okay.
Personal growth, self-exploration,
Okay.
even team building in organizations. It's really about tapping into creativity, enhancing communication, and fostering deeper connections, both within yourself and with others.
So it's a very versatile approach with applications beyond just traditional therapy. The chapter also mentions another pioneer, this time in family therapy, Virginia Satir. She seems like such a remarkable woman.
She was incredible.
Known for her warmth and empathy and, of course, those legendary hugs. What was her approach to family therapy like?
So Satir's approach is known as Satir Transformational Systemic Therapy.
Right.
It really emphasizes communication, self-esteem, and emotional congruence within families. She believed that healthy families can thrive when they're able to communicate openly and authentically.
So what does it mean to have emotional congruence within a family?
Well, it means being genuine and making sure your words, your actions, and your feelings are all in alignment, so they're all sending the same message. It's about being true to yourself and expressing your emotions honestly, even within the complex dynamics of a family.
So it's about creating that space where everyone feels safe to be themselves and express their emotions without fear of judgment.
Exactly. Satir believed that when family members could communicate openly and congruently, it creates this foundation of trust and intimacy, which then leads to healthier relationships and greater individual well-being.
It makes sense that when family members feel seen and heard for who they truly are, it fosters this really supportive and nurturing environment.
It does.
The chapter mentions that Satir was particularly interested in communication patterns within families. Can you tell us a little more about that?
Yeah, Satir saw those dysfunctional communication patterns as the root of a lot of family problems. And she actually identified 5 common communication styles that people tend to use under stress.
Oh, like defense mechanism.
Exactly.
Okay, what are they?
There's the placator, the blamer, the computer, the distractor,
expert speaker,
and the leveler.
5 communication styles, that's fascinating. Can you tell us a little more about each one?
Sure. Let's start with the placator. The placator is the one who tries to please everyone and avoid conflict at all costs, even at the expense of their own needs. They often say things like, "Whatever you want is fine with me," but inside, they might be feeling resentful or unheard.
It's like they're prioritizing harmony over authenticity, which can lead to a buildup of unexpressed emotions.
Exactly. And then there's the blamer. Blamers are quick to point fingers and find fault with others. They use a lot of you statements and try to control others through criticism and accusation. And that creates a lot of tension and defensiveness within the family.
It's like they're deflecting responsibility and projecting their own insecurities onto others.
Yeah, exactly. And then we have the computer, who is very rational and emotionally detached. They focus on facts and logic, and they avoid expressing their feelings. While this might seem like a way to maintain control, it actually prevents them from connecting with their own emotions and the emotions of others.
It's like they're shutting down those emotional channels to protect themselves from getting hurt.
Right. And then there's the distractor. Distractors, they're masters of changing the subject and avoiding those tough conversations. They use humor, silliness, or irrelevant topics to shift the focus away from the real issues. While this can lighten the mood, it prevents genuine emotional expression and resolution.
So sometimes those attempts to lighten the mood can actually be a way of avoiding those deeper issues.
That's right. And finally, we have the leveler, which is the most congruent communicator of them all. Levelers express their feelings clearly and directly, using I statements and taking responsibility for their own experiences. They're honest, assertive, and respectful of both themselves and others.
That sounds like the ideal communication style.
It is, and Satyr's whole approach was really about helping families move towards that more congruent and authentic way of communicating.
It makes so much sense that open and honest communication is that foundation for trust and intimacy, both within families and in any relationship, really.
It is. And another key aspect of Satyr's approach was her emphasis on self-esteem and personal growth. She really believed that therapy wasn't just about fixing problems, but about helping people become more fully themselves.
So it's about embracing those unique qualities that make each person special and helping them reach their full potential. And it sounds like she really embodied those values of warmth and empathy and compassion in her work with families. The chapter mentioned those famous Satyr hugs.
Oh, yes. She was incredibly skilled at creating this safe and nurturing environment where individuals and families could feel loved, accepted, and empowered to grow. And she didn't just talk the talk. She used a lot of experiential techniques in her work.
Oh, I love that. What did a typical family therapy session with Virginia Satyr look like?
Well, imagine a family therapy session filled with movement, touch, and creative expression. She might have families create sculptures or maps to represent their family dynamics, or use role-playing to help them understand different perspectives. She was all about bringing those family dynamics to life in a way that was both playful and profound.
So it was about making those often invisible dynamics visible.
Yes.
And finding new ways to relate to one another.
Exactly. Satyr was a master at bringing those hidden patterns and emotions to the surface and helping families create more fulfilling and authentic connections.
And this experiential approach really aligns with the overall theme of our deep dive, which is the power of experiencing emotions rather than just talking about them.
It does. Satyr, just like Perls and Greenberg, understood that real change happens when we actually engage with our emotions, not just analyze them. Her work continues to have a huge impact on family therapy today. And her legacy of warmth, empathy, and transformative healing continues to inspire therapists and families.
It's amazing how those pioneers in the field of experiential therapy paved the way for this more human-centered and holistic approach to healing. We've covered so much ground in this deep dive already, from Gestalt Therapy to EFT, IPT, psychodrama, and now Satyr's transformational systemic therapy. It's amazing to see how all of these approaches share this core belief in the power of experiencing emotions, and how they each offer these unique tools and techniques for fostering healing and growth.
It really shows the diversity and the richness of the field.
It does. Now, before we move on to explore the broader applications of these therapies and some potential considerations, are there any key takeaways or reflections that you'd like to share about what we've covered so far?
Well, what I find so striking is how these approaches encourage us to view therapy not as just fixing what's broken, but as this journey of self-discovery and growth.
Right.
They invite us to tap into the wisdom of our bodies and our emotions, to explore those often hidden parts of ourselves and our relationships, and ultimately create this more fulfilling and authentic life.
It's like we're reclaiming those parts of ourselves that we've been taught to suppress or ignore.
Yes.
And embracing the full spectrum of human experience.
Exactly. And it's exciting to see how these therapies are continuing to evolve and integrate new perspectives.
Yeah.
Paving the way for even more innovative and effective approaches to healing and growth.
I'm so eager to see what the future holds for this field. But before we get ahead of ourselves, let's take a closer look at how these therapies are being applied in different settings and explore some important considerations for those who might be interested in exploring these approaches.
Yeah, that's a great idea.
So with all this emphasis on feeling and expressing emotions, are experiential therapies appropriate for everyone? Are there certain individuals or situations where this approach might not be the best fit?
That's a really important question. While these therapies can be so powerful and transformative for many, they're not a one-size-fits-all solution. As with any therapy, it's so important to consider the individual's needs, personality, and the specific challenges they're facing.
So it's about finding the right tool for the job.
Exactly.
Not assuming that one approach will work for everyone.
Right. For example, someone who is very intellectual or analytical might initially resist this emphasis on feeling and experiencing emotions. They might prefer a more cognitive approach, something that focuses more on understanding their thoughts and beliefs.
So someone who's used to processing the world through logic might find it really challenging to dive into that messy world of emotions.
Yeah, it can feel really uncomfortable or even overwhelming at first. And for those individuals, maybe a more gradual approach might be necessary. Perhaps starting with cognitive therapy to work on those thought patterns, and then incorporating experiential techniques later on.
So meet them where they are and find a pace and approach that feels safe and manageable for them.
Exactly. And experiential therapies might not be suitable for people who are very impulsive or who have difficulty regulating their emotions.
Okay.
The intensity of emotional exploration might actually be too destabilizing for them.
So if someone's already struggling to manage their emotions, diving into those depths without the coping mechanisms in place could be counterproductive.
Right. In those cases, it's crucial to work on developing those emotional regulation skills first, maybe through something like dialectical behavior therapy, or other approaches that emphasize mindfulness and distress tolerance. Once those skills are in place, then experiential therapies might be a really valuable addition to their treatment plan.
This highlights the importance of having a really thorough assessment with a qualified professional.
Definitely.
They can help determine if experiential therapy is a good fit or recommend other approaches if needed.
Absolutely. And it's important to remember that these therapies are not recommended for people who are actively experiencing psychosis or have severe cognitive impairments. In those cases, other treatment modalities might be more appropriate.
So it's about recognizing the limitations
Uh-huh.
of experiential therapies and making sure that people are getting the most appropriate and effective care for their needs.
Exactly. And, even within the realm of experiential therapies, there are all these different approaches and techniques.
Hmm.
And what works for one person might not be as effective for another.
Right.
It's about finding the right therapist, the right approach, and the right techniques for each individual.
This speaks to the importance of personalized therapy
Yes.
and finding a therapist who really understands your unique needs and preferences. This deep dive has been so insightful.
I'm glad you think so.
I can already see how these principles we've been talking about can be applied to everyday life.
Oh, absolutely. Experiential therapy, it's not just about what happens in the therapist's office. It's about shifting our perspective on how we relate to our emotions and to the people around us.
So what are some ways that these principles can be applied outside of a traditional therapy setting?
Well, for one, cultivating here and now awareness, that's a key principle in Gestalt therapy, can be really helpful in our daily lives. It's about paying attention to your thoughts, feelings, and bodily sensations right now. Instead of dwelling on the past or worrying about the future, this practice can really help us feel more grounded, more connected to ourselves, and more able to respond to challenges in a thoughtful way.
So it's like bringing that mindfulness practice, the one we hear so much about these days,
Yeah.
into every aspect of our lives.
Exactly. And the different communication styles Satter talked about can be incredibly helpful in navigating all sorts of relationships, not just family dynamics, recognizing those patterns. Whether you tend to placate, blame, compute, distract, or level,
Right.
it can give you some valuable insights into your own communication patterns and help you become a more conscious and effective communicator.
I can definitely see how that would be so beneficial. It's like having a roadmap for understanding how we show up in relationships.
Right.
And how we can communicate in a way that's both authentic and respectful.
Yep.
And what about the specific techniques used in these therapies? Are there any that we can adapt for personal growth and self-exploration, even if we're not in therapy?
Definitely. Journaling can be a really powerful tool for exploring your emotions and thoughts. You can use it to process difficult experiences, track your emotional patterns. You could even experiment with different perspectives, like the role-playing techniques used in psychodrama.
That's a great idea. It's like creating your own personal psychodrama on paper.
Exactly. And another really powerful technique is something called empty chair dialogue.
Oh, yeah. We talked about that earlier with Gestalt Therapy.
Right. You don't need a therapist to do this. Just imagine someone you have a conflict with sitting in that empty chair and have a conversation with them. Express those unspoken thoughts and feelings.
So it's a way to kind of work through those unresolved issues and create a sense of closure, even if you can't have that conversation with the person directly.
Exactly. And those are just a few examples. The great thing about experiential therapy is that it gives you the power to become an active participant in your own healing and growth.
Right, both inside and outside of the therapy room.
Exactly. And as much as these therapies encourage self-exploration and personal growth, they also highlight the importance of seeking professional help when you need it. There are times when we need the guidance and support of a trained therapist to really navigate those more complex or challenging emotional landscapes.
That's such an important point. It's about recognizing our own limits and knowing when to reach out for help.
Yes.
This has been such a rich and thought-provoking exploration of experiential therapy. I feel like we've only just scratched the surface, but we've given our listener a really great overview of the key principles and approaches and applications of these therapies.
Yeah, we've covered a lot of ground.
We have. Now, what continues to intrigue me is how these therapies really encourage us to pay attention to the wisdom of our bodies, not just our minds.
That's a great point.
It makes you wonder, what message is your body trying to tell you that you haven't discovered yet?
It's true. Sometimes our bodies know things before our minds do. What I appreciate about these therapies is that they offer a more integrated and holistic approach to healing. They honor the interconnectedness of our minds, bodies, and emotions.
And that's what makes them so powerful. It's not just about fixing a problem or changing a behavior. It's about embracing our whole selves and understanding how those different parts of ourselves work together, to create our unique experience of the world.
Yes. And as we've seen, experiential therapy isn't just about individual healing and growth. It can also have a big impact on our relationships, especially within families.
Absolutely. The approaches we talked about, especially those pioneered by Satir and Perls, really highlight the importance of creating that safe and supportive environment where family members can communicate openly and authentically.
It is so important. It's about fostering those connections and understanding those communication patterns that can either strengthen or weaken those bonds.
And it's not just about fixing problems.
No.
It's about creating a more fulfilling and meaningful family life.
Exactly. It's about empowering families to really tap into their collective wisdom and create those positive changes.
Right, that benefit everyone. This deep dive into experiential therapy has really expanded my own understanding of how we can approach healing and personal growth. It's clear that these approaches offer this unique blend of creativity and emotional exploration.
Yeah, they do.
And practical tools for creating lasting change in our lives and our relationships.
Yeah.
But with any therapeutic approach, it's really important to be aware of any potential challenges or limitations.
It is.
Are there any specific things our listeners should keep in mind as they consider exploring these therapies?
Yes, there are a few things. While these therapies can be incredibly transformative, it's important to remember that they're not a quick fix.
Right.
They often involve delving into some pretty deep emotional territory, and that can be challenging, even uncomfortable at times. It requires a willingness to be vulnerable, to face those difficult emotions, and really embrace that process of growth and change.
So it's about recognizing that this is a journey, not a destination.
Yeah.
And that there will be ups and downs along the way.
Exactly. And it's also really important to be mindful of the potential for re-traumatization. If someone has experienced trauma in the past, diving into those emotions without proper support and guidance could actually be harmful. It's really important to work with a qualified therapist who really understands trauma and can create a really safe and supportive environment.
So finding a therapist who's a good fit.
Yes.
Someone who is experienced in working with trauma and who can create that safe container for healing and growth.
Exactly.
What about those intense emotions that might come up? We've been talking about how these therapies encourage emotional expression.
Right.
But what if someone's feeling really overwhelmed or flooded with emotions during a session?
That's a good point. Experiential therapy can bring up some really powerful emotions, and it's really important for therapists to have the skills to help clients regulate those emotions. A good therapist is going to provide you with those tools and techniques for grounding and self-soothing. They would never push a client beyond their limits.
So it's about finding that balance between encouraging emotional expression but also making sure that clients feel safe.
Exactly. It's about creating a space where clients can feel both challenged and nurtured, allowing them to explore their emotional landscape at their own pace.
This reminds me of the importance of trust in the therapeutic relationship.
It's essential.
For these therapies to be effective, clients have to feel safe and comfortable enough to be vulnerable.
They do.
And open up.
The therapeutic relationship is the foundation for any successful therapy, but it's especially crucial in these therapies. because clients are encouraged to step outside their comfort zones
Right.
and explore those deeper emotional realms.
And finding that right therapist can make all the difference.
It can. It's about finding someone who really aligns with your values, understands your needs, and creates that space of trust and empathy, where you can feel truly seen and heard. It's about finding that right therapeutic partnership, where you can embark on this journey of healing and growth together.
Speaking of healing and growth, one thing that strikes me about these experiential approaches is their emphasis on authenticity
Yeah.
and living a more congruent life. It's not just about fixing problems or managing symptoms. It's about becoming more fully ourselves.
That's right. It's about embracing those unique qualities that make us who we are and living in alignment with our values
Right?
and our desires. It's about understanding that our emotions are not our enemies, but really valuable guides that can lead us towards a more fulfilling and meaningful life.
It's like we're reclaiming our right to feel fully, express ourselves authentically, and create a life that really reflects our truest selves.
Beautifully said. It's about embracing the full spectrum of human experience, with all its messiness and beauty, and recognizing that we are not broken, we're perfectly imperfect beings, capable of incredible growth and transformation.
And as we've explored in this deep dive, experiential therapy offers this wide range of tools and techniques to really support us on that journey, becoming more fully ourselves.
Absolutely. And what's so exciting is that this field is constantly evolving
Yeah.
and integrating new perspectives,
Mm-hmm.
which means there are even more innovative and effective approaches on the horizon.
It's inspiring to think about the possibilities. But for now, I think it's time to shift our focus back to our listener
Okay.
and think about what they might be taking away from this deep dive.
Mhm.
What are some key insights or reflections you think might be resonating with them right now?
I think one of the most important things for your listener to remember is that the journey of self-discovery and healing is very personal.
Right.
There's no one right way to approach it.
Mhm.
What really matters is finding what works for you,
Okay.
what feels authentic
Right.
and supportive to you.
That's such a great reminder. It's about honoring our own unique needs and preferences
Yes.
and trusting our intuition as we navigate the world of therapy and personal growth.
Absolutely. And while we've focused on specific approaches like Gestalt Therapy and EFT, psychodrama, and Satir's work,
Right. Those are just a few.
those are just a few examples.
There are so many other experiential therapies out there.
There are, each with its own unique perspective
Right.
and set of techniques.
So it's really about exploring those different options and finding what feels like the best fit for you.
Yes, it is.
It's about embracing that sense of curiosity and being open to trying different approaches
Yeah,
until you discover what really resonates
that's right.
with your needs and your goals.
And one of the beautiful things about this type of therapy is that it encourages us to become active participants in our own healing
Right.
and growth.
Yes. It's not about passively receiving treatment. It's about engaging
Yeah, you're not just sitting there.
with our emotions
You're taking part in it. You're exploring.
and experimenting with new ways of being
Yeah,
and relating.
exactly.
It's recognizing that we have the power to heal and transform our lives.
We do. And it's not just about individual change either. It's also about creating these ripple effects that extend outward.
Yes. To our families, our communities, and the world around us.
Absolutely. When we heal ourselves, we heal the world.
I love that. These therapies remind us that we're all interconnected
We are.
and that our well-being is intertwined with the well-being of others.
Exactly.
This has been such a profound and inspiring deep dive into the world of experiential therapies.
Mhm.
I feel like we've gained a much deeper understanding of how these approaches work,
Yeah, me too.
the unique benefits that they offer,
Mm-hmm.
and some of those potential challenges to be aware of.
It's been an incredible journey. And while we've come to the end of our deep dive, I hope your listener feels empowered to continue exploring
Yes,
these amazing approaches to healing and growth.
I completely agree. So to our listener, thank you so much for joining us on this adventure into the world of experiential therapy.
Yeah, thanks for listening.
We encourage you to keep exploring, keep feeling, and keep embracing the fullness of your human experience.
Yes.
Until next time, happy diving.